I'm Dr. Jay Kumar. I'm an interventional pain and spine specialist at Duke Health. I work alongside
Melanie Ellers, nurse practitioner. Let's talk about back pain. One of the most important things with neck and back pain is that it can take away those things that make people happy in their life. Playing with their kids, doing exercise that they wanted to do.
When it starts to begin to affect your quality of life, your day-to-day, that's when that should be your trigger to be like, hey, you know what, maybe I shouldn't have to suffer through this stuff.
If you come in as a back pain patient and you've never ever been treated for back pain before, we're going to start at the bottom. We're going to try to figure out where it's coming from, and that's going to be our number one thing. What's causing it?
There's different causes for different types of back pain. That chronic pain that stays there, that's a different cause than the back pain that perhaps shoots down the leg, or sciatica is a common way to think about it.
Nerves could be getting pushed on by discs or some bony overgrowth in the low back. Pain that starts in the back and stays in the back, doesn't travel anywhere else, is usually from wear and tear.
There's no such thing as a blanket therapy for everybody.
Yeah, some of the most basic things. Physical therapy is a great tool to help identify where it's coming from while also treating you. I typically do recommend procedures before I would ever consider medications, just because procedures address the root of the problem. We're able to put the medicine directly where the pain starts.
The days of covering things up with a Band-Aid or kicking the can down the road, maybe that worked in the past because we didn't have all the medical advancements we do now.
The shift has changed to more long-term modalities, so things that are going to last longer than a couple hours or 3 months at a time. And those are in the form of stimulators or neuromodulation.
You're modulating or affecting how the transmission of pain goes from point A to point B. For example, neuropathic pain, the numbness, burning, shooting, tingling, pins and needles pain. These nerves are rapidly firing. Picture a bunch of kids inside of a jungle gym, one of those blow-up, what are they called?
Bouncy house?
Bouncy house. Picture kids inside of a bouncy house, but use that example for the tip of a nerve ending. Using a stimulator allows the kids in a bouncy castle to kind of calm down a little bit. And sure, there's going to be 1 or 2 kids that are still bouncing, but the entire class is not bouncing anymore. And using that concept is kind of what modulation of nerves and stimulators do.
Everybody has pain. Bring it up. The sooner you bring it up, the quicker we can capture your pain and make you feel better so you can get back to those normal day-to-day activities. Seeing the patients turn around, they're able to go travel with their grandkids. They took them to Hawaii or something like that, and man,
Disney World, I had one.
It's heartwarming, really just seeing people back in their sweet spot in life and getting to do those things and experiencing life.
For as long as possible, yeah.
Yes.
Walking unassisted is a big deal for Jim Maharter because back in 2003, while riding in a car on I-95 near Wilson,
I got hit from behind and sent into another vehicle, and 5 cars tumbled and all that. And I ended up with a plate in my neck and injuries to my spine.
When he first came here, he was on high-dose narcotics. He was in a wheelchair. He didn't walk.
The pain so severe that doctors prescribed a heavy dose of fentanyl. But now he's off opioid medications after a neuromodulation procedure by Dr. Ashish Kumar. A spinal cord stimulator implanted in Jim's body sends electrical impulses to a patient's brain that interrupt pain signals. That's why he's walking pain-free today.
It's empowering. It's very empowering, psychologically and physically. I feel my body starting to change again. It's been well over a decade that I've used that cane.
He's not just relying on waiting for the device to allow him to walk and do all these things. He had the determination that is needed by patients in order to get to that next level.
I prayed, and I never dreamed that I would have what I have now.
Dr. Kumar says the device can help people in pain avoid potential addiction of opioids.
You gotta have or go to somebody that can help you break that cycle. Otherwise, you're just gonna continue on and you're not gonna get the pain relief that you need, and you're gonna continue to suffer from chronic pain despite all these medications that you're on.
Anybody 20 years ago who wanted to have pain relief, they didn't have the options they have now. These options are phenomenal. It truly is a godsend.
He is so impressed by the device, he wants others who suffer from chronic pain to know there are ways to treat it without the risk of opioid addiction.
According to the CDC, chronic pain affects about 50 million American adults.
WREL's Megan Glova explains how an implant helped this woman return to an active life.
Once an active kindergarten teacher in Durham, Meredith Mooney's life took a sudden painful turn.
So I actually woke up on September 1st, 2018 with excruciating back pain.
X-rays and MRIs offered few clues.
Unfortunately, for the longest time, all we had really had opioid-related medications to treat pain.
Dr. Jay Kumar, a pain specialist in Charlotte, tried more conservative approaches first with no progress. Mooney tried several rounds of oral steroids.
It took a very big toll on my body. I was tired of a Band-Aid. I wanted a solution.
Dr. Kumar turned to Stim Router by Bioventus, FDA approved in 2015. The minimally invasive procedure uses a thin lead wire placed near the peripheral nerve.
A small wearable power source communicates with the lead wirelessly.
That is what the device looks like.
It sticks to the skin.
It sits right on top of where the leads are.
And you can turn it on and off and control it with a remote.
Unfortunately, Mooney learned that her insurance provider would not cover the cost of close to $8,000.
I paid all of this out of pocket. So it was a choice I decided to make. I made the right choice because I hadn't felt my toes move since 2020.
Now she's walking normally and more active than she's been in 4 years. Megan Glova, WREL News.
A Bioventus representative says Medicare and many private insurance companies reimburse the Stim Router.
Spinal cord stimulation, also called SCS, uses electrical impulses to relieve chronic pain of the back, arms, and legs. It is believed that electrical pulses prevent pain signals from being received by the brain. SCS candidates include people who suffer from neuropathic pain and for whom conservative treatments have failed. The injection site is anesthetized. One or more insulated wire leads are inserted through an epidural needle or through a small incision into the space surrounding the spinal cord, called the epidural space. Electrodes at the end of the lead produce electrical pulses that stimulate the nerves, blocking pain signals. The patient gives feedback to help the physician determine where to place the stimulators to best block the patient's pain. The leads are connected to an external trial stimulator, which will be used for approximately 1 week to determine if SCS will help the patient. If the patient and physician determine that the amount of pain relief is acceptable, the system may be permanently implanted. At the end of the trial implantation, the leads are removed. The permanent implantation may be performed while the patient is under sedation or general anesthesia. First, one or more permanent leads are inserted through an epidural needle or a small incision into the predetermined location in the epidural space. Next, a small incision is created and the implantable pulse generator, IPG, battery is positioned beneath the skin. It is most often implanted in the buttocks or the abdomen. The leads are then connected to the IPG battery. The implant's electrical pulses are programmed with an external wireless programmer. The patient can use the programmer to turn the system on or off, adjust the stimulation power level, and switch between different programs. After surgery, patients may experience mild discomfort and swelling at the incision sites for several days.
My name is Jay Kumar. I'm an interventional pain and spine specialist at Duke Health. So commonly I see a lot of patients with back pain, joint pain, knee pain, shoulder pain, or everyday exercise pain related to golf or tennis or things like that. I also commonly see patients that suffer from neuropathic type pain, such as like the pains that shoot down their legs or numbness and tingling in their feet. In regards to interventional pain, we use an X-ray machine. Everything we do is very precise, very accurate to almost the millimeter. It's not a surgery. It's not having to go to the hospital, having to get admitted. It's a quick outpatient procedures that are just done, once again, under x-ray guidance, and it's very accurate, very quick. It's important for me, for the patient to understand why they're getting something done or doing something. I explain things, I'll draw pictures, I point things out on the MRI or on the x-ray so that they kind of understand really what is going on and what is happening to their inside their body and why we are doing what we're doing. What I find most gratifying is when I see those patients, we do these procedures. Let's say it was a golfer that just wanted to simply be able to have a better handicap and beat his buddies at golf. When that patient comes in, we do a certain treatment plan, or he comes in for a procedure or two, and sometimes they'll return just to let me know that, thank you for everything you did, and I'm able to go back and do what I need, and I probably won't see you again. I've had that happen several times.
Finally, there's a smarter treatment option for patients suffering from chronic pain. Spinal cord stimulation, or SCS, has been a safe and effective treatment for over 50 years to treat chronic pain. Now there's an approved Smart SCS therapy, the Evoke Smart SCS system that automatically adjusts with every heartbeat, breath, and movement. Here's how it works. Pain signals travel through the spinal cord to the brain. The device interrupts those signals before they reach the brain and then automatically adjusts over 4 million times a day, like having a two-way conversation with your spinal cord to maintain consistent pain relief. The procedure positions two thin wires called leads along the spinal cord, which are connected to an implanted stimulator. The outpatient procedure allows most patients to go home the same day. The Evoke Smart SCS device can be used all day, including when you're exercising, sleeping, and driving. Only the Evoke Smart SCS system is backed by the most rigorous clinical study in the history of spinal cord stimulation. After 3 years, 4 out of 5 patients reported more than 50% pain relief, and nearly 3 out of 5 patients reported more than 80% pain relief. Is the Evoke Smart SCS therapy right for you? You can try it out first to be sure. During the trial, 2 temporary leads are placed along your spinal cord and connected to an external test stimulator. After several days, you and your doctor will discuss how well it manages your pain. Get back to living the life you want. Ask your doctor if the Evoke Smart SCS therapy is right for you.
A breakthrough treatment for chronic pain is here. It's HFX, a spinal cord stimulator, or SCS treatment option. HFX incorporates the most advanced SCS available, offering the widest range of frequencies and waveforms available to individualize your relief. It's FDA approved and is the only SCS system demonstrated to provide more people with significant relief from back pain, leg pain, and pain caused by diabetic neuropathy in clinical studies. Even people who have tried surgery and medications in the past may be good candidates for HFX. In fact, 8 out of 10 people who used HFX for severe chronic pain experienced a significant reduction in their pain, allowing most people to return to everyday activities and get back to what they enjoy. With patients suffering from chronic pain, abnormal pain signals are sent through the spinal cord to the brain. The HFX solution calms the nerves that carry these signals to provide lasting pain relief. In a simple procedure, thin, insulated wires are placed in the back near the spinal cord and connected to a small, implanted, rechargeable device. The device sends mild electrical pulses to the spinal cord to calm the nerves and reduce chronic pain. The procedure involves a relatively quick and minimally invasive outpatient procedure, which means you will likely go home the same day. You can use HFX 24 hours a day, including when you drive or sleep. Before committing to the procedure, you'll complete a 1-week trial where you and your doctor will assess its effectiveness in managing your pain. During the trial, the 2 wires are inserted in the back near the spinal cord and attached to an external battery. 9 out of 10 people who try the HFX solution stay with it. Ask your doctor if the HFX solution is right for you.
My name is Leo Capurro. I'm a pain physician in Winston-Salem, North Carolina. Well, I heard from colleagues of mine about their initial successes with the procedure. These were some really compelling results, and I was just so impressive that I said, I really have to try it. I think that the pain tech seems to be very responsive, is minimal invasiveness of the procedure itself. It's simplicity. It's the patient adherence to idea of doing this type of the procedure, especially when it comes to this type of small implant. Well, I definitely wanted to see the long-term data, randomized prospective study, because these are now a large number of patients who underwent this procedure. It looks really good. The procedure is simple. The approach is straightforward. It seems to be quick learning, fast adoption curve, no complications, no serious complications that I could see. So I'm looking forward to do more of it.
PainTex Link is an innovative way to solve patients' SI joint pain, using SI stabilization with a minimally invasive medical procedure. Patients get long-term benefits and faster recovery than other SI fusion methods. The process is broken down into 4 steps. First, the Steinman pin is inserted into the SI joint, between the sacrum and the ilium. There is no drilling involved. Next, the tissue dilator and working cannula are inserted, creating separation in the joint. Then, the brooch rasp is inserted to create room for the link allograft to fit comfortably and at the same time initiate decortication. The brooch and rasp are removed with a simple unscrew, reverse hammer, and pull motion. Finally, a large graft window of the link allograft is filled with DBM and placed into the SI joint. The insert ensures that the link is positioned perfectly, allowing SI fusion to begin. This step helps create the perfect growth environment for Link to work. Link enables you to fix the pain, not mask it, allowing your patients the ability to take back their life again.
To just do a stretch, and she said she kind of like heard a pop and felt something in her hip, and when she came home that night, she was crying and she was in a lot of pain. I had this little sharp shooting pain down my leg. We found out I tore my labrum from stretching, and from that, I ended up having 5 surgeries.
Thoughts in my head, a collage and they spread. I'll be great one day, going off of my meds. No, I'm not giving up, no, I'm not giving in. I will make it to the top, taking off in the wind. I gotta make it. I'm saving every day to taste it. I'm patient, but my mind, it can hardly take it. I'm chasing a dream that I've had for several ages of vacant. Modern kids up with a taken.
With my outside dance team, and all of that was just not, I was not able to do that anymore, which was really, really hard because I don't ever slow up, no I don't take shit, I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up and make a statement. I don't ever slow up, no I don't take shit, I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up and make a statement.
Pain
management doctor suggested that she tried the spinal cord stimulator trial. And, you know, at first we were kind of like, oh, this is probably going to be just another thing that's not going to work.
When they turned the device on for the trial, I was confused at first because I was waiting for the pain to start up, but there was nothing, and it was kind of a moment of like, wow, like this is finally the thing that's gonna work for me. Currently, I'm in school to become a physician assistant, and I would definitely say that from the 10 years of living in chronic pain and, you know, seeing a million different healthcare workers and seeing how hard that they tried to help me was definitely it like paved the way for me in a sense of what I wanted to do when I was older. No, I don't think I'd be able to go to school and do what I'm doing now if I didn't have the implant.
If chronic pain is keeping you from the everyday activities you love, you've probably tried a number of treatments to help manage it. Medications, nerve blocks, surgeries, and more. But because we feel pain and respond to treatments in different ways, these therapies may not always provide the long-term relief you're looking for. Spinal cord stimulation, or SCS, is a safe, drug-free, FDA-approved pain management therapy that's used by tens of thousands of people around the world and is clinically proven to help reduce chronic pain. And with Boston Scientific, this treatment can be tailored to your unique needs and preferences. Here's how SCS works. When you feel pain, in your back or leg, for instance, it's because nerves from that part of your body are sending pain signals through your spinal cord to your brain. SCS is designed to interrupt those pain signals using a small device called a stimulator and thin insulated wires called leads. The stimulator generates mild electrical pulses that travel through the leads to nerves in your back, interrupting the pain signals before you sense them. SCS systems can be programmed to deliver different types of therapies. Some therapies replace your pain with a soothing, tingling sensation. Others use a kind of stimulation you don't feel at all. With Boston Scientific's SCS systems, you get to choose which of these therapies works best for you. You can even switch from one to another or use multiple therapies at the same time. The ability to use more than one therapy simultaneously is unique to Boston Scientific's SCS systems and has been clinically proven to provide greater relief from pain. Boston Scientific's WaveWriter Alpha SCS system includes a fast therapy option designed to provide rapid and profound relief you'll start to feel immediately. And it can be used during everyday activities, including while you're driving or sleeping. A key benefit of SCS therapy is that you can try it out with a temporary trial system to see if it works for you. Your doctor positions the leads and connects them to an external stimulator that's worn around your waist. Then, for the next few days, you'll be able to experience what SCS feels like as you walk, sit, sleep, and get back to enjoying life. And getting back your life is what SCS therapy is all about. A recent clinical study found that patients using Boston Scientific's SCS therapies reported a greater improvement in their ability to do everyday activities than patients reported in other studies using non-Boston Scientific SCS systems. And with WaveWriter Alpha, you get the comfort of knowing your SCS system provides access to full-body MRIs, should you ever need one. Beyond your life-changing therapies, Boston Scientific also provides Cognita Care, a range of support tools and services you can use before, during, and after your procedure, so you can learn, connect, and thrive. Connect with one of our patient education specialists to answer any questions you may have. Or chat with a volunteer patient ambassador about their personal experience finding lasting relief with SCS. And for additional support at your fingertips, download the My SCS app. Get on the path to personalized pain relief. Visit pain.com to find resources and learn more about safe, effective pain relief with Boston Scientific. If you're one of the millions of people living with chronic pain due to lumbar spinal stenosis, or LSS, chances are you're taking medication to treat your symptoms. You may even be contemplating major back surgery. But there's another, simpler solution from Boston Scientific. It's called the Vertiflex procedure, and it's been proven to provide long-term relief from pain while reducing the need for medication and avoiding irreversible surgery. LSS is a condition that develops gradually over time and is most common in adults over the age of 60. The condition narrows the space in the lower or lumbar spine, causing nerves to be pinched. This results in pain and discomfort down the back and into the legs. In fact, people with LSS may experience a variety of symptoms, including pain while walking or standing, weakness in the legs, a loss of balance, decreased physical endurance, numbness or tingling in the legs, buttocks, or back, and an aching, dull back pain that spreads to the legs. People with LSS often feel the need to sit or lean forward, as this opens up space in the spine and temporarily relieves the pressure on the nerves. The Vertiflex procedure creates a similar effect using a small spacer. Here's how it works. During an outpatient procedure, a small spacer will be placed inside your spine. Once inserted, the spacer's arms open around the spinous processes. Those are the bumps you could feel in your spine, to help create more space for the affected nerves. This provides the same feeling of relief you get from sitting or leaning forward. Unlike other, more invasive procedures, the Vertiflex procedure doesn't require the removal of any bone or tissue, so it doesn't impact your ability to have different treatments in the future. General anesthesia is not required, and you should be able to go home the same day. The Vertiflex procedure is backed up by multiple clinical studies. In one study, 9 out of 10 patients reported being satisfied with their pain relief and their increase in physical activity. In another study, 85% of Vertiflex procedure patients reported that they stopped using opioids, while others significantly decreased their usage. The Vertiflex procedure has already helped thousands of patients get back to enjoying their everyday lives. And with Boston Scientific, you also get Cognita Care, a range of support tools and services you can use to learn about pain solutions. Connect with education specialists to answer your questions. Chat with patient ambassadors about their personal experiences and receive ongoing support before, during, and after your procedure. Talk to your doctor to see if the Vertiflex procedure may be right for you. And visit pain.com/VF to learn more about our personalized pain solutions and dedicated care. Radiofrequency ablation, or RFA, is a minimally invasive, non-surgical procedure that can be used to treat pain in various parts of the body. If you suffer from chronic pain in your back, neck, knees, shoulder, hips, SI joints, or feet, RFA might be an option for you. Here's how the procedure works. RFA targets the nerve or nerves causing your pain and uses a radio frequency current to interrupt the pain signals right at their source. Your doctor will use imaging to guide a special probe to the target nerve. They will then send a small radio frequency current through an electrode into the surrounding tissue. Heating the tissue in this way disables the nerve so that it stops sending pain signals. During the procedure, your doctor will target a number of nerves based on your unique therapy needs. RFA is a relatively quick outpatient procedure. After the procedure, you'll be advised not to engage in strenuous activity for at least 24 hours. Over the following few weeks, your pain should subside, allowing you to return to the activities you enjoyed before the onset of your chronic pain. Pain relief typically lasts for many months, at which point the RFA procedure can be repeated. RFA is proven effective in relieving chronic pain. A recent clinical study showed that 80% of patients treated with Boston Scientific's RFA therapy reported a reduction in pain of 50% or more 1 year after the procedure. Over 85% of the patients said they were satisfied with the improvement in their symptoms. And in another study, patients reported continued pain relief even 12 months after the procedure. In addition to RFA, Boston Scientific provides Cognita Care, support tools and services you can use to learn about Boston Scientific's portfolio of drug-free, minimally invasive solutions for people living with chronic pain. To learn more about Boston Scientific's radiofrequency ablation, talk to your doctor or visit pain.com/RFA.
If you're experiencing intense pain that started after an injury or a surgical procedure, you might have something called Complex Regional Pain Syndrome, CRPS, or Kazalgia. When you have this kind of chronic pain, it can be impossible to focus on anything else. Though spinal cord stimulation, also called SCS, has been used by doctors to treat chronic pain for more than 50 years, initial research indicates that traditional SCS systems show only minor improvements for patients with CRPS or Kazalgia. Today, there's a non-opioid solution called dorsal root ganglion therapy, or DRG, that's been proven to work for people who have complicated conditions like yours. The therapy works by targeting the clusters of nerve cells along the spine known as dorsal root ganglion, or DRG. These DRG nerves control pain signals from specific areas of the body where people experience pain, enabling DRG therapy to provide targeted relief at the source. One of the benefits of Abbott's Proclaim DRG therapy is that you can try it out before committing to a fully implanted system to see if it is right for you. This is done through a minimally invasive procedure. Your doctor will determine whether you are a candidate for Proclaim DRG therapy and may introduce you to an Abbott representative who can help answer your questions about the therapy. Your doctor may also recommend a temporary evaluation to determine whether the therapy is right for you. During the evaluation, you can see whether the therapy provides meaningful pain relief while improving your ability to perform daily activities. A typical evaluation period for the Invisible Trial System for Proclaim DRG therapy lasts 5 to 7 days. The process begins with a quick outpatient procedure. At the start of the procedure, you will be positioned on the operating room table. Once you are comfortable, the doctor will place thin wires, called leads, alongside the DRG. The leads are connected to a small external battery that provides the energy to generate pulses, which work to interrupt your pain signals before they reach the spinal cord. During the evaluation, the battery will be worn outside of the body, typically on your lower back. At the end of the procedure, you will be taken to a recovery room to rest. In the recovery room, your Abbott representative will program your system under the supervision of your doctor. Throughout your evaluation period, your Abbott representative may contact you to ensure you are getting appropriate pain relief on the intended areas of your body. It is important that you continue to perform day-to-day activities as recommended by your doctor. While you may be experiencing some temporary minor discomfort from the procedure, you will want to focus on how the therapy is managing your chronic pain. You should avoid bending, twisting, stretching, or lifting objects over 5 pounds. Avoid getting the bandage and battery wet. At the end of the evaluation, the leads will be gently removed during a check-in visit at your physician's office. You and your doctor will decide whether the Proclaim DRG system is right for you. The Proclaim DRG neurostimulation system with invisible therapy provides low-energy, superior therapy, utilizes a recharge-free battery, giving you hassle-free pain relief with a battery that lasts 6.5 years on nominal settings, is controlled with Apple digital devices and Bluetooth wireless technology, features upgradable technology to deliver advancements without additional surgery, allows scanning with a wide variety of medical imaging techniques, including MRI. So easy to use you may forget you're treating pain. Find a Proclaim DRG therapy trained doctor at aboutyourpain.com. Don't wait. Ask your doctor about getting targeted relief with Proclaim DRG therapy.
At Abbott, we understand the heavy burden of chronic pain. We know pain has the power to take over your life, both physically and mentally. Today, there's a new radiofrequency ablation option, also known as RFA, that targets specific nerves to block pain signals from reaching the brain. Abbott's Ionic RF generator provides precision therapy where it's needed the most. RFA therapy has been shown to effectively target pain signals in several discrete areas of the body, such as the neck, upper back, lower back, SI joint, and facial pain. RFA therapy is a well-established treatment for chronic pain, with over 225,000 people receiving RFA in the U.S. each year. Abbott's RF therapy is a non-surgical treatment for chronic pain. The therapy is administered much like an injection and is performed in your physician's office. A needle is placed at the site of your pain, and energy is delivered to a targeted nerve to block the pain signals traveling to the brain. Abbott's RFA therapy provides safe and effective long-lasting pain relief. It is administered in a quick, non-surgical outpatient procedure, and it is a minimally invasive non-opioid technology. Research confirms long-lasting pain relief following a single RF therapy procedure. Patients have reported pain relief lasting from 6 to even 12 months. With Abbott's RFA therapy, it's possible for you to forget your pain and get back to your life. Ready to learn more? Find a physician who uses Abbott's Ionic RF generator at ionicrf.com.
Living with chronic pain creates a heavy burden. Pain has more than the power to limit your life. It has the power to take over your life, both physically and mentally. That's why it's important to utilize the right therapy to help you manage your pain and regain your full potential. One of the benefits of the Proclaim XR SCS system with Burst DR stimulation therapy is that you can try it out before committing to an implanted system, empowering you to see if it is right for you. This is done through a minimally invasive surgery. During the evaluation, you can see whether the therapy provides meaningful pain relief while improving your ability to perform daily activities. If your doctor decides you're a candidate, a typical evaluation period for the Invisible Trial system lasts 5 to 7 days. The process begins with a quick outpatient procedure. At the start of the procedure, you will be positioned on the operating room table. Once you are comfortable, the doctor will place thin wires, called leads, into the epidural space. The leads are connected to a small external battery to provide the energy to generate pulses, which work to interrupt your pain signals as they travel from the spinal cord to the brain. During the evaluation, the battery will be worn outside of the body, typically on your lower back. At the end of the procedure, you will be taken to a recovery room to rest. In the recovery room, your Abbott representative will program your system under your doctor's guidance. Throughout your evaluation period, your Abbott representative may contact you to ensure you are getting appropriate pain relief on the intended areas of your body. It is important that you continue to perform day-to-day activities as recommended by your doctor. While you may be experiencing some temporary minor discomfort from the procedure, you will want to focus on how the therapy is managing your chronic pain. You should avoid bending, twisting, stretching, or lifting objects over 5 pounds. Avoid getting the bandage and battery wet. At the end of the evaluation, the leads will be gently removed during a check-in visit at your doctor's office. You and your doctor will decide whether the Proclaim XR SCS system with burst DR stimulation therapy is right for you. Proven effective and preferred by more patients. The bold choice for people who are ready to live life more fully. Burst DR stimulation has been clinically proven to provide superior relief from pain and its associated suffering compared to traditional neurostimulation therapy. Reduce or eliminate the tingling sensation felt with traditional neurostimulation. Improve the ability to perform everyday activities. More than 8 out of 10 patients say they prefer burst DR stimulation. Additionally, the Proclaim XR SCS system provides recharge-free pain relief, unlike rechargeable systems that require frequent charging sessions to maintain therapy. That means extra time to do things you love. Be bold. Live XR. Ask your doctor about the Proclaim XR SCS system or learn more at proclaimxr.com.
I have patients coming back to my office for follow-up visits, and a lot of them will say, I love my SCS, it's working great, but I just don't like the way I feel when I swim, when I exercise, when I raise my arms, or when I cough and sneeze because I don't like the buzzing sensation. And as a result, they turn down the stimulation, they receive sub-therapeutic dose, and makes SCS not as effective as before.
Pain is a very powerful determinant to how people are able to function in their day-to-day life, and it changes in day-to-day activities.
With open loop stimulation, for so many years, we've been flooding signals and stimulation at the spinal cord without any feedback or response.
Imagine if a patient is sitting upright and they cough or they arch their back, there's going to be a change in the spacing between the cord and the wire that we use for stimulation.
Even simple things like coughing have an impact in the consistency of dose being delivered to the patient. And that's a very, very powerful thing. Inceptiv is the starting point of a complete paradigm shift.
Inceptiv's closed-loop algorithm works by actually listening for an electrical signal that travels up and down the spinal cord in response to stimulation.
With closed loop, we can have instant automatic adjustment from moment to moment based on the patient's activity to provide a more consistent delivery of stimulation.
When we were working on the Inceptive system, we wanted to make sure that the technology that we developed with closed-loop spinal cord stimulation could also support contemporary types of therapy, like differential target multiplexed or DTM therapy. There's many elements that go into the design of a spinal cord stimulator. There's ensuring a robust battery design. There's ensuring robust MRI capability.
We know 98% of patients within a 10-year time frame will need an updated MRI imaging.
That's almost every patient we have. We may be treating their lower back pain right now, but what if they develop other conditions? With Inceptive, our patients can now access 3T MRI.
Medtronic stands far and above their competition in terms of consistency and access for their patients to the best quality MRI-compatible devices.
The Inceptive system has the most advanced technical capabilities that are available.
It's a milestone moment for our specialty because it's transformational.
This is going to be a landmark moment in medicine, be a groundbreaking moment for our specialty and for the field of interventional pain.
Inceptive is making the real-time adjustments to the patient's therapy so they don't have to think about it. It allows them to live their lives. It allows them to get out of the bed, to move around, to spend time with their family and be engaged in living, doing the things that make us humans.
I knew from a long time ago that I would have back pain. For 25 years, I worked with children and young adults with physical disability. And there was a lot of lifting in and out of wheelchairs, on and off beds, just trying to get through the basics of keeping the house clean, the ironing done, was all I could do. By the time I'd cook dinner at night, I was in too much pain to even want to eat it. So life was pretty awful. And so I made an appointment and poured out my story and said, life's not worth living anymore. And he said, I think I can fix that for you.
Inceptive senses each person's unique body signals and adjusts pain treatment as needed. Inceptive SCS does not depend on adjustments from the patient to maintain stimulation, instantly adjusting therapy delivery in real time. This allows Inceptive to provide consistent therapy while patients perform a full range of daily activities. With Inceptive SCS, patients can now enjoy greater freedom.
Having the Inceptive device inserted in my body has been a life-changing experience. I was so limited in what I could do. And this device has just freed my life. I don't feel the stimulator at all during the day. I was just able to get back into the garden, do my cooking, entertain, do all my bush walks that I wanted to do, and just be outdoors because that's where I love being most of all. The most wonderful thing about having this pain relief has been that I've got my life back again. I feel 10 years younger, and I can do just whatever I want to do. It's only a very small device, it's only quite tiny, but does a big job. It's wonderful.
PainTech's Link is an innovative way to solve patients' SI joint pain, using SI stabilization with a minimally invasive medical procedure. Patients get long-term benefits and faster recovery than other SI fusion methods. The process is broken down into 4 steps. First, the Steinman pin is inserted into the SI joint, between the sacrum and the ilium. There is no drilling involved. Next, the tissue dilator and working cannula are inserted, creating separation in the joint. Then, the broach rasp is inserted to create room for the link allograft to fit comfortably and at the same time initiate decortication. The broach and rasp are removed with a simple unscrew, reverse hammer, and pull motion. Finally, a large graft window of the link allograft is filled with DBM and placed into the SI joint. The inserter ensures that the link is positioned perfectly, allowing SI fusion to begin. This step helps create the perfect growth environment for link to work. Link enables you to fix the pain, not mask it, allowing your patients the ability to take back their life again.
So I experienced the pain for about 2+ years, and I noticed it after I had the spinal cord stimulator put in my back. I was still having pain. So then we started seeing pain doctors, and I went through the shots, the RFAs, and whatever else people were trying. And then it wasn't getting there, so I started on the pain medication, and that was probably 5+ years ago. All the pain, it affects your whole life, your job, your family, everything. And you're just stuck doing nothing until you can move again. My first pain management I started with was chiropractor. He got me walking again, because I was actually hunched over and tilted for about 2 weeks. After 6 months, I wasn't going to get any better than that, because if I went golfing, I couldn't even walk the next day. I actually gave up golf. No, I have no reservations for having a procedure. I am off pain pills now. I was on them for like 6 years. It definitely helped me. Since the procedure, I can go to the driving range. I'm starting it slow. Once it cools off down here, I'm going to hit a course. I used to ride bikes. I've done centuries. It's 100 miles in a day. And I couldn't even get a half mile in before I started feeling pain. Now I've gone at the gym on their bikes, as far as I want to go. I'm getting the quality of life back, and I'm still trying to work to get even more things done.
My SI joint pain in the beginning, when I first came to Dr. Azim, was extremely severe, and it was the point where I was basically immobile. It was an effort just to get out of the chair, to walk to the bedroom, to go to the restroom. My hobby and passion is fishing, and to lose that was very frightening. At first, of course, you have some reservations, but the way Dr. Azim explained it to me and how the procedure would work and how simple it was really a no-brainer. It is a relatively non-invasive surgery. It's just a small incision, and then when you come out, everybody's so pleasant and nice. Well, if I had known sooner about the procedure, we'd have done it 2 years earlier. We went just as soon as we could get approval, and he'd done the diagnostic injections prior to it. It's an amazingly simple solution. There's no after feeling or that there's anything there. I just feel normal. And my pain was reduced by 85 or 90%. Fortunately, after having the surgery, I've been able to go out in the boat, and we've been out several times.
Before the link procedure, I couldn't walk very far. I was in so much pain that I was willing to try anything. I've had injections, and I've also had bricks inserted into the SI joints, and they were not working. When it came to the point of being confined to home and losing independence, my reservations went on vacation. If you're going to prescribe medicine, I'm not going to take it. He says, that's good, I don't prescribe it. So we're going to get along just fine. To me, it was like pain-free. And trust me, I've had more than my share of procedures. He got me all prepped, took me back there, and then they said, you can get up now. You're done? That's how quick and easy it was. I saw results right away. I just noticed that the pain is gone. It's great that I'm where I'm at. I'm back up and mobile, and I'm very thankful for every day that I live.
Are you one of over 2 million patients annually diagnosed and in treatment for lumbar spinal stenosis, also known as LSS? With LSS, you're likely experiencing a variety of symptoms that are affecting your daily life, including pain and discomfort. If your current treatment isn't providing you with adequate relief, the mild procedure could be your next step. Mild is a low-risk, minimally invasive procedure that removes a major root cause of LSS to help patients achieve lasting relief from back and leg pain. Unlike some major surgeries, mild doesn't eliminate future treatment options or other co-occurring therapies for back pain, because with mild, no major structural anatomy of the spine is altered. Mild is a short outpatient procedure that has a similar safety profile as epidural steroid injections, but with lasting results. Mild is covered by Medicare nationwide, and unlike surgery, the procedure requires no general anesthesia, no implants, no stitches, no steroids, and no opioids. With LSS, the spinal canal narrows and compresses the spinal cord nerves in the lower back, best visualized as a kink in a drinking straw. On your X-ray, your mild doctor will identify and evaluate the problem area to determine your candidacy for the mild procedure. The entire mild procedure is performed through a single tiny incision in your lower back. Your mild doctor will use an imaging machine and specialized tools to remove small pieces of bone and thickened ligament to restore space in the spinal canal and reduce the compression of the nerves. In other words, remove the kink in a drinking straw. The mild procedure is performed by interventionalists and typically takes less than an hour. Most mild patients return home the same day with very little pain, often none at all. Following treatment with mild, patients often resume normal activity within 24 hours with no restrictions. Your mild doctor will likely provide you with a simple at-home physical therapy regimen to increase walking and core strength, allowing you to continue to experience improvements in mobility over time. Thousands of LSS patients are treated annually with the mild procedure. With an 85% patient satisfaction rate, studies show that mild continues to improve patient functionality over time, including increased mobility and reduction of pain. In a Cleveland Clinic one-year study, results find that patients were able to increase their average standing time and their walking distance with less pain.
Every day I pinch myself still that I'm walking without pain. I just don't take it for granted because I was in pain for so many years.
The Evoke stimulator has impacted my life by allowing me to return to work, and that's been the biggest impact for me because I had not been able to work for about a year and a half. It also has allowed me to continue now with my normal household chores, shopping, dishes, vacuuming, all the different activities that I like to do, or don't like to do, but have to do. And it has allowed me to be able to continue to do outdoor activities. I look forward to doing some fishing this summer. And I also have some grandchildren that I want to be able to visit, and I want to be able to hold them and play with them. And up until I got the stimulator, I hadn't been able to do that.
I had severe pain in my back and going down my leg and into my foot, which was nerve pain. It started from an accident back in 2009. I tried all the natural things. I did acupuncture, I did the chiropractor, I did physical therapy, and I was literally trying to get my kids through high school before I took care of myself. So then I finally saw a surgeon, and I had 3 different surgeries. And after the 3 different surgeries, nothing helped. And my husband met Quentin and Joel through business, and they got to talking about Saluda Medical and what they were doing, and it was absolutely a perfect match. I was still on lots of pain medication. I mean, tons after 3 surgeries. And when they came to me and we had, contact with each other, we decided to go forward with it. I met Dr. Capral in the office along with Joel and Quentin, and we had a long discussion about it because, of course, I was a bit nervous going through something a 4th time and still being on pain medication. So it sounded like a good fit, and they invited me into the trial study. So I decided to go ahead and do it. It took me a couple months, but then I went back to them and I said, yes, I'm ready for it. And so then I joined the trial study. I don't have any pain whatsoever anymore. I'm on no medications. I was on probably 5 or 6 at the time. I'm taking nothing right now, and I exercise a lot, which I did before, but I'm back to doing that. I'm back to walking, playing tennis. I'm just very active again, happy, doing the things that I didn't do for about 8 years.
I was a banana grower, in Coffs Harbour, and also I was a motor mechanic as well for 20 plus years, and both those professions are very hard on your back and your spine, and so those industries that I was working in did actually impact my life, and finally it eventually ruptured my spine, ruptured my vertebrae and discs, so I had chronic pain there from the 1970s. Saw my GP first, and they did some x-rays and MRIs, and they located a problem, and they just said, no, you've got ruptured discs, and that needs surgery straight away. So I came down to Sydney and saw Royal North Shore, and they had a look at it all and decided it needed surgery, and fairly urgently, and which they performed. Yeah, it relieved the pain, but still I was having pain further down the track. It didn't really fix the problem, and I had to sort of, I came back to Sydney and asked them, look, I'm still having trouble with this spine, and then they found that, look, maybe you need an implant put in of some description to help with the chronic pain. So they put in a morphine pump, an intrathecal morphine pump, which is a different company altogether, and I had that in for 10 years, and it was helpful, but I was very evasive with all the drug that was going via slow-release morphine to the spine. It was killing the pain, but I was sort of like a zombie for quite a while, and I didn't really like that system. It eventually ruptured, and I had to get it out after 10 years of work. I went back to work for a while with the pump inside me. I went back for another 5 years, but still it was still painful, and I had to sort of do some other alternative stuff, but it was hard. It was very hard. So I came back to Sydney and asked these guys, and they said, look, that thing's about to rupture anyway, and we need to get that out. So I got it out, and then after a while I stayed on patches, morphine patches and other drugs to try to help with the pain. I came back to Royal North Shore, the pain clinic, and they told me through the pain clinic that there was a device available down the track. Would I like to participate in a clinical trial? And I said yes. And I went on that trial, and was very successful, found it really, really helpful, stopped the pain, and it was just brilliant. They trialled it on me externally first, and I trialled it for a week or so like that before they decided to fit it in. Yeah.